An adverse event is any untoward medical occurrence that may present during treatment with a pharmaceutical product, but which does not necessarily have a causal relationship with the treatment. Okay. And whereas an adverse drug reaction is which is noxious and unintended and which occurs at doses normally used in man for the prophylaxis, diagnosis, or therapy of disease or for modification of physiological function. When you just read you will be able to understand that why the drug could have been prescribed, and with that drug what is the adverse reaction that has happened, and in that there could be some reason that this is the drug that has caused this adverse event. If you are able to conclude this statement, we call this as adverse drug reaction. Okay, this is very important because you should not get confused or you should not interchange all these words. Why this is more important is like when the causality is once you determine the causality, that adverse drug reaction is going to be of important and you have to monitor this further, and if there is a possibility that you can reduce that ADR, you have to do that from your side. So that is the reason why adverse drug reactions are all taken into serious considerations. Okay, so and also like if a subject make a phone call to any call centers and say that I got this drug and had an adverse event, you should not get panicked that that could be caused because of this drug. There should always be a scientific conclusions. As you might have seen in that introductory classes, they might have told like if any adverse event, if it is received, it has to be processed in various workflow states, and there will be medical reviewers who will be exclusively doing this assessments. Okay, so you will be reading about all these in later part. So now for understanding purpose, you just keep in mind like an adverse event, it does not have a causal relationship. When an adverse event have a causal relationship, we call it as adverse drug reaction. Okay, we will be seeing examples at the end of session for this adverse event and adverse drug reaction. So that being said, for understanding purposes and for interview point of view, this classification is important. Okay, what are the types of adverse drug reactions? Okay, according to pharmacological classification, we have these 6 types, that is type A, augmented reactions, type B, bizarre reactions, and type C is chronic effects or due to continuous drug usage. And type D is delayed reactions, and type E is end of the dose, and type F is failure of therapy. We are just going to expand in the next slide. So these are the different types of adverse drug reactions. So when it comes to type A, this is the real side effects what you are going to see with the normal doses and is expected. Say for example, when you have seen any leaflet of drug, it might have mentioned that nausea, vomiting and diarrhea. These are the most common adverse effect of any drug. So why they say this is most common is because this is expected to happen in normal doses. And also these are mild and manageable. This is not going to create a big impact on patient's well-being. So for one example for that is cetirizine. As we know that cetirizine can cause sedation, but when it comes to severe allergic reactions or a cold, we will prescribe cetirizine because other than this adverse effect, the patient need to have little bit of relief of symptoms. So based on that, we will prescribe cetirizine. So this type A or those minimal, mild and manageable side effects that occur with normal doses. Whereas when it comes to type B reactions, this occurs most commonly with drug allergies. So what does this type B reaction means? It is unexpected, but it can happen with normal doses. One example of that is penicillin, which can cause anaphylaxis. So the best example for type B reaction is hypersensitivity reaction. Say for example, I will try to explain this to you with a bell-shaped curve. If you are able to follow it, it is well and good. Or if you find it difficult, you can just leave it off it. Okay. So once you take a drug, what it happens, say for example,